Vaccine deliveries continue to ramp up in this country. We're now on track to receive more than 36 million doses of a total of 3 different vaccines by July. But there are concerning signs of vaccine hesitancy among some Canadians. According to Statistics Canada, more than 2/3 of Black Canadians are reluctant to get a shot. Dr. Onye Nnorom is the president of the Black Physicians Association of Ontario. We reached her in Toronto. Dr. Nnorom, welcome to the program.
Thank you.
Now, as we just mentioned, 2/3 of Black Canadians are reluctant to get the vaccine, according to the information put out by Statistics Canada. Why do you think that number is so high?
Well, that number, based on our experiences as Black health leaders, is based on distrust. And I use distrust instead of mistrust. And so a lot of that is experiences of anti-Black racism, both historically and, a lack of equitable response by health leaders and public health leaders to address the disproportionate impact that the COVID-19 pandemic has had on Black communities. So we know that Statistics Canada has addressed that as well, but based on, lived experience of our health needs or social needs not being equitably met compared to the rest of society, then with this vaccine, there is a distrust. And then that becomes an area where you can have, all kinds of myths or misinformation come in. But the foundation of that is a distrust based on lived experience.
I definitely want to dig into those foundational issues that you're talking about. And obviously, we want to talk about ways to address them. But I'm also curious, within that broader context that you're talking about, do you think that the discussions that we have around particular vaccines are also relevant to this conversation? I think of the discussion around AstraZeneca, for instance. There's been a lot of talk about, well, is it right for this population or that population? Recently, we heard about the prospect of it being linked to blood clots in Europe, although that doesn't seem to be in any way an issue with the supply in Canada, but it is being investigated. Do you think that those conversations matter, or is this really just about much bigger issues?
Certainly they matter, and we know, as you mentioned, that the AstraZeneca issue is being addressed. But we know that the studies that looked at the issue of distrust, which occurred in November by the Public Health Agency of Canada and by Statistics Canada in September, far precedes the issue of the AstraZeneca vaccine. So we know that for Black communities, this distrust, existed prior to that. And as Black health leaders, we've come together based on this journey. So not just based on what's happened over this time, to say we need to have an equitable response for 2 reasons. One is certainly there's this opportunity with the vaccines, overall vaccines still being our best line of defense against the COVID-19 pandemic. But fundamentally, when health leaders were saying that this pandemic was going to be the great equalizer, Black health leaders in Ontario published a position statement a year ago, basically saying that there were going to be inequities, that Black communities and other communities that face similar challenges and social issues were going to be disproportionately impacted. So we've come together, the Black Physicians Association of Ontario, Black Health Alliance, the Black North Initiative, and the Black Opportunity Fund, in collaboration with Black health organizations across the country, to really try to revisit this conversation around the need for equitable access to testing, to vaccines, to mitigation efforts. The need, yes, for Black health education or culturally appropriate education in Black communities that requires resources to address the issues that people have around the distrust. And then, ultimately, the collection of race-based data done in an ethical and respectable manner with Black community leaders at the table. So these are the things that are going to be necessary, along with a number of structural issues that are related to anti-Black racism that are in our position statement.
When it comes to the issue of hesitancy or reluctance itself, you are a family health doctor, you're a public health specialist. Can you give me an example of the kinds of things that you have heard from Black Canadians that you've worked with that sort of speak to where this reluctance comes from on an individual basis, experiences that you've heard about?
Yes, some of them are, I would say, common misconceptions, like the idea that the vaccine has been rushed, right? Mm-hmm. So having an understanding for me as a physician, being able to explain that actually, the vaccine or the technology from the vaccine was longstanding. Some of this work was done previously with regards to the SARS virus. And so there was opportunity and funding to make sure that we do have these vaccines now. Those are some of the ways that we're able to, as Black health leaders, address the myths. But ultimately, I think it's about the source of where the information is coming from, because we do know, again, that when it comes to government, healthcare, researchers, there is a legacy of, Black populations being used as guinea pigs. There is a legacy of not rising to the challenge when we are facing inequities, really due to factors to do with anti-Black racism. So we are the people, for instance, who are the PSWs. So you do see Black and racialized people disproportionately represented in those fields, and sometimes did not have appropriate personal protective equipment. So while they, at the beginning of the pandemic, did not have ways to protect themselves and their families, there's going to be a distrust when people say line up for this vaccine. So there is a need, to provide that information. But like I said, at the end of the day, our communities, and Statistics Canada showed it, have been disproportionately impacted, but not listened to. Our leaders really have really tried to make awareness or make people aware or leaders aware of this last year. So I'm really hoping that by being here, that, people will read the recommendations, but for people who look like me and do not look like me, will rise to the challenge and say, this is a group that's been disproportionately impacted. And leaders flagged this a year ago, and we would have all been better off if they had been listened to then. So, the real message is, can you hear us now?
I wonder where you stand on prioritizing, given what you have said, what the numbers show about Black community and other visible minorities being disproportionately affected. Where do you stand on prioritizing Black communities as we start to look at a greater and greater rollout of vaccines?
So certainly there are messaging at the federal level and at provincial level and local level where different groups or communities or neighborhoods are prioritized. And so we are really advocating for kind of what's called a racial equity impact analysis, thinking about which groups, again, due to systemic racism, end up being more vulnerable to the COVID-19 vaccine, to the COVID-19 virus, and making sure that vaccine is available, but also resources that are available for, appropriate health promotion and peer educators and the things that we know work in our communities.
Doctor, we're going to have to leave it there, but thank you very much for your time today.
Thank you for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.